Okay, guys, it's just a kind of inevitability that every so often you're going to not sleep well for a couple of nights. Maybe you're going to work out a little too hard and push the limits a little too much. Or, just something funky happens, like you're trying to get your kid out of the car and you turn the wrong way, and now your back has seized up, it's flared up, and it's just not doing great, right? You're having a bad couple back days. So what this series right here is, the goal here is to build some motion and some relief back into all of the joints and muscles of your lower back so that you can get back to a place where the bigger, more effective movements are going to actually fit into your program and into a place where your back is not going to just react and throw its guard on, right? So if you're at a spot where you can hardly move and you've really thrown your back out, then we have our TVL-DO with L5S1, which is also inside of this series here. But the next stage here is going to be to reintroduce some kind of relative motion to it so that we can get our lower back to stay calm, get our hips moving again, and get some blood flow and some movement back into the joints of our lower spine, all right? So the first thing we're gonna do is go ahead and do some just breathing awareness exercises. And now, I'm not saying that you need to meditate here or you need to say any mantras or anything, but I really do want you to just become aware of your breathing, where your breathing is in your body, the rate of your breathing, and just a lot of the different qualities of it, okay? So make sure you have a nice comfy mat. You can do this on your bed, that's totally fine, but for the last exercise, you can put your legs up on the wall. So being in a position here on a nice mat is preferable, okay? So we're gonna start with our knees bent. Okay, knees bent, feet underneath your knees, knees in line with your hips. And all I want you to do is just start to become really aware of the cadence of your breathing. And we're gonna start to slow our breathing down to a 4 or 5 second inhale, 4 or 5 second exhale. And we're just gonna do that for about 2 minutes, all right? So take a small breath in, take a full exhale out where you let your ribs fall and your body fall into the ground. And then now we're gonna take a slow 4 second inhale. No hold at the top. We're going to easy exhale for 4. And then we're going to hold our breath for 4 at the end of the exhale, trying to fall into the ground. 4 in. 4 out. 4 hold. 4 in. 4 out. 4 hold. Good, guys. The entire time you're doing this, you try to be aware of any tension around your belly or your lower back, trying to keep everything very calm. 4 in. 4 out. 4 hold. 4 in. 4 out. 4 hold. Last breath, guys. 4 in. 4 out. 4 hold. Gently now, you're going to bring your left knee to your chest. I want you to grab onto your left knee. And I want you to try to notice where your body had to move to allow your left knee to be here, and then try to release all of that tension. So if I feel like I kind of folded myself like a pretzel to get my left knee to this place, all I'm going to do is just try to relax that so that my body is really, really settled into the ground. And now I'm going to start my breathing again, but I'm going to specifically try to breathe into my left back pocket here. I want my leg to be totally, totally dead, okay?
I don't need to have any tension in my leg. I don't need to have any pull on my leg. My arms are doing the work to hold it here. My body is totally relaxed against the ground. And all I'm doing is just breathing deep towards my hip. Ever so gently, I'm just pulling my left knee a little bit closer to my chest the whole time, but I want to make sure I'm not arching my chest off the ground, right? I'm staying very heavy, very relaxed into the ground here. 2 more deep breaths. And again, as you breathe into that left hip, almost the same way like when a balloon fills with air, there's tension now in the balloon, in the rubber. You're going to feel tension in your glute when you do this, but that's good. It's like you're expanding the muscle from the inside out. Give me 1 more breath in and out. And then easy as you exhale, you just gently set that left leg down, and now you're going to bring your right knee to your chest. I say to your chest, I just mean up, right? It doesn't need to be super tight with your hip, especially if you have a little pain in the front of the hip. No problem there. You just want the leg to be dead, totally inanimate, and now you're breathing into your right glute. Try to notice if there's a difference between one side and the other, especially if you have like a little nerve pain in the butt cheek or a little nerve pain in the lower back on one side versus the other. There's definitely going to be an asymmetry, but that's just a little bit of extra kind of oomph on your awareness to say, okay, can I relax the muscles or the tissue or just the joint or whatever it is in that area as I breathe into that spot. Two more breaths. Again, I'm very heavy through my chest. I'm not arching. One more. Easy, set that right leg down. What we're going to do now, guys, is we're going to start to introduce some motion through our hips using our glutes and our hamstrings, right? So my goal for you here is not to thrust your hips to the ceiling. My goal is for you to feel like you roll your tailbone off the ground, right? So what I want you to feel is that my tailbone and the backside of my pelvis is perfectly settled on the ground. I can feel my heels on the ground. All I'm going to do is think about if my butt cheeks were flashlights, I'd want to point the flashlights to the ceiling. So I'm going to start to scoop my tail and lift my butt 1/2 inch off the ground. And then I'm going to roll my hips back down, making sure I don't miss a single segment of my body. Now I'm going to tuck my tail and roll my hips up 1 inch off the ground and then roll them back down. Push through the heels, roll the hips 1.5 inches. And each and every rep until your hips are about 6 inches off the ground, we're going to slowly increase the height and the range of motion, trying to feel that both butt cheeks and both glutes are working equally. But I don't want to skip a segment. I don't want to start to go fast and start to move like a lever or like a plank. I want to move like a wave the whole time. So I start with my bottom part of my tailbone, then I roll to my high part of my tailbone, then my lower back, and then everything rolls back down in reverse. Roll up, and then roll down. Okay, guys, so your pace, your comfortability with this, your height is going to be totally dependent on how your body feels, right? So I don't have any nerve pain in my lower back or in my glute right now. So for me, it's not so bad to just go a little faster or move a little bit more with a little bit more pace. But if I did have a flare up or if I did have a lot of tension in my lower back, there's no rush to go from one height to the next, right? You might have 6 or 8 reps where you hit a point that it's uncomfortable and you don't need to try to push through that just to get higher, right? Your goal is to get to a place where it feels like it's uncomfortable, but you slowly work through it so that now that movement isn't uncomfortable. Once that's the case and you've kind of become aware of that pain and that tension that you're carrying, then you can go a little faster, or you can go a little higher, but all the time making sure that you're moving with good quality. Good again, guys, making sure my ribs are heavy on the ground. My heart is like heavy through the ground. I just do not want to arch my chest here. Roll the tip of the tailbone, then the butt cheeks, then the lower back, then the mid back, then the ribs. Perfect. And then we roll everything back down in reverse. And you can feel, especially towards the end, towards that lower part of your lower back and your pelvis, as you roll down, am I falling to the ground or am I rolling to the ground? Give me like 3 or 4 more reps, guys. And we roll down and up. If you want to think about like the hinges on an old door, if they're squeaky and they're kind of rusty, you don't want to just slam the door open and closed. You want to just want to ease it in, man. Just want to ease it in. Weight through the heels, using the ground to push my hips up. Give me 1 more rep. And then we're going to roll down. Perfect. Good, guys. Okay, the next thing we're going to do is just called a global stretch for all the muscles of our hips and our lower back. Okay, so we're going to bring our left knee up, grab onto it with our left hand, and now our right knee up, grab onto it with our right hand. Okay, in yoga, they call this the happy baby. Okay, with our hands wrapped around our shins, just below our knee on both sides, I want you to start to try to at least initially just get comfortable being here, okay? Especially if you're tight in your hips and tight in your lower back. This position is just it's gonna cause a lot of, not confusion necessarily, but there's just a lot going on here, or could be going on here. So all I want you to do is just try to return to your smooth breathing. Okay, and again, just like you practiced before, I'm breathing downward towards my pelvis. And I want my tailbone, just like we practiced with the hip rolls that we just did, to become very heavy through the ground. Okay, my feet are falling outward towards the ground, meaning they're not turning inward towards each other. They're falling outward. Heard that pop in my hip. Oh man, that's funny when that happens. Okay, so now as I try to breathe downward towards my feet, I just want to ever so gently pull my knees towards my armpits. If I pull too hard, too fast, my hips will roll up like this. I don't want that. I want the bones of my pelvis to stay very heavy on the ground. My back of my head, my ribs is all very heavy on the ground. But I'm pulling gently my legs towards my armpits. Totally okay if you need to re-grip every minute or so. I'm having to re-grip right now. And again, I'm just focused on being relaxed. And breathing downward. Imagine that you could actually push in the same way you use a plunger. Okay, imagine that you could use your breath as like a plunger to push your hips towards your feet, right? Everybody thinks about getting taller by pushing their head off their neck, but what if you could breathe downwards and try to push your hips towards your feet? You could actually decompress or take out the dents in your lower back. I want you to do that. And again, there's an ever so gentle, consistent focus on keeping the chest heavy as I pull my knees towards my armpits. We're going to be here for another 30 seconds or so. Give me one more slow, deep breath. Really trying to breathe into the lowest part of your body that you can feel. As you pull your knees towards your armpits, hopefully you're still breathing in. And now very slowly, you can let go of the tension in your legs. Kind of guide your legs back to the middle. Set one foot down and then the other. Beautiful. Okay, so our hips are nice and warmed up. Our lower back is feeling nice and warm as well. So we're gonna now get into our TV Eldoa and then our L5S1 Eldoa, okay? So for the TV Eldoa, guys, I'm gonna show you how to get basically onto the wall, and then you can adjust your distance from there based on your tightness and your level of discomfort that you have relative to your back and your hips. So go ahead and scoot your left butt cheek all the way to the wall, okay? I'm gonna scoot a little forward so that when I lay back, I'm hopefully still in the middle of the camera here. But I'm gonna now roll onto my back. My left hip is still touching the wall. I'm gonna use the ground and the wall to turn myself so that my legs are straight up and down the wall, okay? And now I can use my elbows here a little bit and kind of just use myself on the floor to position my body so that I'm nice in a straight line, that everything is aligned here. I don't wanna be way cocked off to the side with my legs or my upper body. I want everything to be nice and straight. Okay, so all we're gonna do in this position now, and again, if you're feeling extra tight, you can scoot 6 to 8 inches away from the wall, all right? Again, you can even, I've had people with severe lower back pain or sciatica symptoms be 1.5 feet, 2 feet away from the wall before they start to progress themselves to the wall. But I'm gonna stay on the wall for now, okay? So I want my butt cheeks and my hips firmly connected to the wall. And my goal is just to let the weight of my legs press my hips heavy into the floor, okay? So the weight of my legs is kind of falling down with gravity. That's coming down on top of my hips, and now my hips and the backs of my pelvis is heavy against the floor. And my job here, guys, is just to breathe into my pockets, both front and back, while letting all of the muscles of my lower back get very, very relaxed, very open, and just continue to try to release any tension that may be there from the injury or tightness that I'm experiencing in this moment. Okay, and so while I'm here, I wanna have a little bit of tension on the back of my legs. I don't need to have my legs like yanking like a full-on stretch, but I don't wanna be completely without tension here. So I wanna have a little tension through my legs, which is gonna create a little bit of pull on my lower back, which is totally fine. And I'm just breathing into my glutes and my pockets here, okay? We're only gonna hang out here for another 20, 30 seconds before we get into our series, before we get into our L5S1 Eldoa. But again, if you're having more severe nerve symptoms or just a lot of discomfort in your lower back, you can hang out here for 3 to 5 minutes before going into the L5, okay? So before going into L5, guys, I wanna make sure I have about, if I open my hand, about that much space between my feet with my legs oriented on train tracks in line with my pelvis, okay? So I could have good spacing, but be over here. I don't want that to be the case. Okay, now my pelvis is very heavy on the ground, and I'm trying to push gently my lower back into the floor without arching my back, okay? So it's like my lower back, the lower part of my ribs, and my pelvis are all flat against the floor from gravity and from my effort here. Now that's my anchor. What I'm gonna do from this point is I'm gonna start to push my heels and reach my heels, is maybe a better word, up the wall against the friction of the paint, okay? So I can feel that if I start to push, I get a little bit more tension on the back of my legs. If I pull my toes down, I get a little more tension on the back of my legs. And now I wanna do those at the same time. So my toes are pulling down, my pelvis and my ribs are heavy, my heels are reaching up. As I reach up, I'm gonna rotate my legs inward. So I don't wanna just rotate in from my foot or my knee, I wanna try to rotate in from my hip. And you'll feel maybe one side is better at this than the other, okay? One side has a little bit more range than the other. So I wanna reach as I rotate. It's like a spiral here, or like a tornado, whatever helps your imagery. I wanna reach as I rotate, reach as I rotate. Again, breathing towards the bottom of my hips and my pelvis. And now both arms can go up to the sky. So if my legs are turned in, my hands are rotated out with my palms flat to the ceiling. As I breathe in, now I'm going to bring my arms over my head. And I want to feel that my arms are lengthening towards the camera while my hips are lengthening to the wall. And I'm going to reach and I'm going to breathe. And so I have a lot of pieces here to try to monitor and stay in connection with. My toes are pulling down. My heels are gently pushing up. My pelvis is heavy or flat against the floor. My ribs are heavy, flat against the ground. The back of my head is heavy against the floor. And now my whole spine is lengthening from north to south. As I reach my arms more, I lengthen through my head more. As I reach my legs more, I pull my toes down a little more. As my hips get heavier, my breath gets a little deeper. Last breath in and out. I'm going to release one arm and then the other. Release one leg and then the other. And I'm going to slowly roll to the side with my shoulders and my legs working together, rolling together. And then now I can come out of that. I can go about my day. Hopefully my lower back feels a little bit better after that, guys. So remember, as you're moving throughout your day, your goal is just to introduce a little bit more motion, blood flow, and awareness into your lower back so that if it starts to seize on you or create a little bit more pain, that you have the tools and the mindfulness to let go of some of that. So you can use all of these exercises in a series like we just did with this video, or you can use them as little kind of a la carte things to just try to relieve some of the symptoms you may be having from a pulled muscle or, re-aggravating an old injury that you have. All right, so see you next time. Aww. Got a phone call. Motherfucker, dude. I meant to put my phone on fucking